Hi, I am Dr. Rakesh Gupta, Sattva Educational Platform. Today we are going to talk about a very important topic, how to diagnose causes of anemia or low HB from reticulocyte count. So basically what are reticulocytes? They are juvenile or immature RBCs. Reticulocytes are formed as a part of process of erythropoiesis. This process is actually normal and eventually it is enhanced in cases of anemia when there is a reduction of erythrocytes or RBCs in the blood. So these are reticulocytes. So they are immature RBCs. Before the full form adult RBCs are formed, they are the precursors of RBCs in immature form. So this is how the reticulocytes look. So what happens is whenever there is erythropoiesis or RBC production, these are the various steps through which the RBC passes on and eventually an adult RBC is formed or a mature RBC is formed. When I say adult, it means mature RBCs. So this erythropoiesis actually happens in the bone marrow. So now let us assume a scenario where there is hemorrhage or there is a bleeding from the body which results into anemia. So what happens is there is production of erythropoietin from the kidneys and there is stimulation of erythropoiesis. And what is the first step is there will be increase in reticulocytes in the circulation, which peaks up to 6 to 10 days and they remain high till the time hemoglobin is normalized. So when you do a reticulocyte count, it is just counting of immature RBCs which are known as reticulocytes. So the formula for calculating a retic count percentage. So retic count percentage is number of reticulocytes which you are able to count in amongst 1000 RBCs divided by total number of RBCs which you have counted that are 1000 into 100. So normal reticulocyte percentage in an adult is 0.5 to 2%. For a neonate it is 3 to 6%. So neonates have more immature RBCs. Let us assume an example of reticulocyte count in an adult. If there are 25 reticulocytes within 1000 RBCs which have been counted, then the percentage of reticulocyte count would be 2.5%. So as I have already mentioned, the normal range for reticulocyte count is 0.5 to 2%. Here it is 2.5, so which is higher. So let us see various scenarios where we will study the combination of hemoglobin and reticulocyte count. So for example, if there is a low hemoglobin with a high retic count, then what are the differential diagnoses which we should consider? So there is a possibility of hemolysis in the body. Second possibility is there is a heavy bleeding or hemorrhage from the body which has resulted into low hemoglobin, or there is a blood loss anemia. There can be hereditary disorders like thalassemias and sideroblastic anemias. Another clinical or physiological condition is pregnancy, where there can be low hemoglobin with high reticulocyte count. Now let us go to another scenario where there is an anemia or low hemoglobin, but there is low reticulocyte count also. So this combination of low hemoglobin and low reticulocyte count, it is usually seen in deficiency states like iron deficiency anemia, pernicious anemia, or aplastic anemia where bone marrow is not functioning, or there are clinical conditions like chronic diseases, especially chronic renal diseases or chronic renal failures, cirrhosis of the liver, or there is bone marrow failure where bone marrow is not at all functioning especially in cases of malignancy or cancer or any form of infections or septicemias. Hope you have understood this. So I would like to end this particular video by thanking you. Thanks a lot.